Welcome. So glad you tuned in on Leap of Faith as we explore ethos. Ethos is about the characteristic spirit of our Catholic culture. It is about trust, credibility, authority. We partner with the University of Dayton as we seek to explore critical issues of our church that help us to broaden our perspective and reimagine our faith. Take the leap with us. Explore the religious imagination. Hello. Our theme for today is pastoral care, pastoral counseling, and spiritual direction. Now, we all know the world we live in today is a complex and rapidly changing place. Technology, politics, and social issues are evolving at a breakneck pace, making it difficult to keep up with the latest developments and understand the impact they have in our lives. High levels of stress and anxiety have been major parts of the COVID-19 pandemic. It has had far-reaching effects on nearly every aspect of life. An American Psychological Association survey from 2021 found that more than 80% of U.S. adults report emotions associated with prolonged stress, and higher levels of stress and anxiety may continue for the foreseeable future. This figure is really astounding because this number would likely include many people with normal stress baselines and solid coping skills. Today we have with us an expert panel of pastoral caregivers to address the various support systems available to us for dealing with stress and healing us in mind, body, and spirit. But before I introduce you to them, let me share with you a quote from Arthur Evans Jr., PhD, and CEO of the American Psychological Association. He states, "Without addressing stress as part of a national recovery plan, we will be dealing with the mental health fallout from this pandemic for years to come. A shallow understanding of how exponential and even everyday changes affect our lives could muddle our view of how we are personally coping with changes and anticipating them. Without a realistic perspective of where we are right now in terms of our personal agility, we will never improve on this capacity." David Riley is one of our panelists today. He served as the Regional Director of Catechesis and Evangelization for the Archdiocese of Cincinnati from 1995 until he retired in 2012. In 2005, David entered studies for community counseling at the University of Dayton. After receiving his degree and licensure, he began work as a therapist in pastoral counseling. In 2011, he entered private practice where he currently sees clients in Dayton, Ohio. So David, welcome to the show. Amy Doorley is the coordinator of graduate studies in the Department of Religious Studies at the University of Dayton. She's also a professional clinical counselor in the state of Ohio, an adjunct instructor at University of Dayton. She enjoys how her counseling work informs her work as a coordinator of graduate programs. Amy, welcome. Deacon Michael Montgomery is a permanent deacon for the Archdiocese of Cincinnati, Ohio. He has been a hospital chaplain for over 9 years at a Level 1 trauma center in Dayton. He is also the director of adult education in 3 parishes in Cincinnati, Ohio. So Deacon Mike, welcome. And we also want to welcome Sister Angela Ann Zukowski. She is the director of University of Dayton's Institute for Pastoral Initiatives and the Virtual Learning Community for Faith Formation. Sister Angela Ann is also co-producer of this Ethos show, and it's thanks to her work that we can meet all these knowledgeable panelists. So Sister, once again, welcome, but I can say welcome home. So let's get started. David, mental health is an essential part of people's lives and society. As a pastoral counselor, you understand mental health conditions are not uncommon. Poor mental health affects our relationships our relationship with God, friends, our community, our well-being, our ability to work. As a pastoral counselor, what are some of the factors influencing people's mental and spiritual well-being today in this rapidly changing world?
Thanks for including me in this panel. It's good to be with you all. I know Michael from past work. I don't know Amy, but it's nice to meet you, Amy. And Sister Angela, I've known you for a while. Strictly speaking, I'm not a pastoral counselor in the sense of representing a faith community in an official capacity. But I am, the way I see myself is I'm a professional counselor, clinical counselor with a faith perspective. And a lot of my clients are referred to me by faith communities, by pastors in the area. And no doubt, as you said, Natasha, the pandemic has created a significant amount of uncertainty. That was one of the factors that I came to mind right away, obviously, and you had mentioned that. There was no, school had to close, jobs had to be taken home, people weren't allowed to come to offices, businesses closed, the economy tanked. There was a great deal of uncertainty in society at that time. And this has all led to a great deal of social isolation. I was looking at a Surgeon General's report from 2023, in which it said that the health effects of the lack of social connection actually increases premature death from 26 to 29%. So it has a significant amount of health effects as well as mental health. Fewer people are affiliating with civic groups, with churches. We know even before the pandemic that mainline church attendance has declined over the past decade or so in a significant way. People who left, who did not come to Mass during the pandemic, many of them haven't come back yet. Everything seemed abnormal. It created a lot of anxiety, a lot of depression, and even long-term physical effects beyond COVID. This has all led, I think, to feelings of loneliness, which is more of an internal state. Many people have written about the pandemic, or the epidemic, I should say, of loneliness. In a 2022 study, it found that only 39% of adults said they felt very connected to other people. About half of them said they experienced loneliness with some high rates actually among young adults. Even though social media has been around for a while and is ubiquitous, a lot of people still feel very lonely in our world today. And that's a big factor, I think. Another one that I experience in my work is trauma. A lot of people that I see have tremendously adverse childhood experiences and also current life situations that have disrupted or overwhelmed their ability to make sense of what has happened to them. When people aren't mirrored as children or even abused when they grow up, they develop a very skewed view of the world and of themselves. A lot of anxiety results, a mistrust of other people. I see anger in my work, depression. When children are neglected, they often have to take on the role of parents, and it makes them very overly responsible for things they can't control. So trauma is a big factor. The last one that I thought of was the notion of secularization in our culture. This overall decline of a worldview in which people have a sense of that there's more to life than just materialism and material success. And I think that has created a sense of separation among people and a kind of loss of meaning for a lot of folks, and has led to violence. We see a lot of an increase in mass shootings, for example, in the United States have increased. So secularization is a big problem, I think, in terms of just not having a sense that we used to have that there is another world that we are that has ultimate meaning to it, and that God is a part of that world. So those are just a couple of things that came to my mind, and I hope I didn't take too much time.
Not at all, David. Thank you for the statistics there about what, the factors that the lack of human touch can actually cause some solid results. I mean, that one about premature death, 29% increase in premature death, that was shocking to me. So, no, not at all. Thank you so very much. Deacon Mike, we want to go to you. What is your experience as a chaplain, hospital chaplain, for addressing the mental and spiritual needs of patients or their families? And tell us the challenges and opportunities that you face with those encounters.
Good morning. So I don't have statistics the way Dave does, but, the number one thing I find as a hospital chaplain is that people have a great desire to be listened to. And while not a licensed pastoral counselor, I've probably seen 15,000 patients or more. And my experience has taught me, to read the room, to get a sense of who needs what. But most times I focus on the patient if they're conscious, obviously. And many times I ask permission if I can hold their hand and talk to them. But mostly I just listen. Part of one of the issues of even getting into a room to meet with families or patients is that people have little idea of what a chaplain is. As Dave talked about with secularization, I think I've been kind of shocked to find people when I say, would you like to pray? And I have heard in recent years, what is prayer? And that it's falling out of our vernacular, it makes me nervous. But still, I do find that most people, even when I explain what prayer is, even if they're not religious, even maybe if they're atheists, although we might say there's no atheists in foxholes, right? They desire prayer. And so listening is still the key to me to figure out, to find out, to discern what people's needs are so that I can bring that to the prayer. Sometimes, and I'll just give you one example, sometimes one time I had to explain to the nurse what a chaplain was, so then she let me in, even though she said the family didn't want a chaplain. And I just walked in and I said, hi, I'm Chaplain Michael. I'm here just to give you support and to let you know that people are here to be for you. And they immediately started talking. Long story short, they explained that this one patient was a cobbler during their life. And through a gift of the Holy Spirit, when we were praying together, because they really did desire prayer, God gave me the words to say that this kind man was a soul worker, right? So he worked on soles of shoes, but much like a haircut, right? Having the right shoes to walk in can help everything in your life be better. And so it was a blessing not only for me, but for the family, so they could reframe even what was happening and give, as David said, a greater meaning and purpose to this kind man's life. And I see that as a chaplain, as if I can help make sense of what's going on a little bit, understanding that suffering is a mystery, but still helping people see some meaning and purpose in the suffering and in the consolation that God is there.
Wonderful. Thank you very much, Deacon Mike. you talked about the importance of human touch, listening, support, discernment. Even when you said, God gave me the words to tell him, he was in terms of the play on soul and soul. And really and truly, that is our synod process, isn't it? So Amy, as an instructor for preparing your students to become qualified, supportive, and healing ministers, how do you prepare students for their future ministry?
Thank you. I would say in my pastoral counseling class, we talk a great deal about the different diagnoses and their effects on family and community life. And I want my students who are preparing to be ministers to have an awareness of their role, not just in being with the people struggling with those diagnoses, but also to be with those family and community members. It's certainly important for students to have some baseline knowledge of clinical mental health issues, but I also spend a lot of time preparing the students just to be ready. To be ready means healthy and ready. That looks like a relationship with God, taking care of yourself, and in taking care of yourself, being ready to hear people, much like what Deacon Mike said. A lot of it is how we listen, how do we hear? So to say more about kind of each of those, having a relationship with God, I'm lucky in that most of my students come to UD in an answer to some sort of call. They have a relationship with God and have been called to some sort of ministry, to more knowledge, to more theology. Oftentimes just a call to more. And they can't quite identify what it is, but they know they want more of God. So my number one is don't get in the way of that. I want them to grow in their relationship, and for my being not to get in the way of that. I want them to have more depth with God, more trust, and more ability to distinguish really when and what it is God is saying to them. I think that's a struggle for a lot of people in life. So we're lucky here at UD. We have a lot of opportunities for our students to experience God. We have the usual kind of Catholic campus offerings: Mass, reconciliation, exposition of the Blessed Sacrament, faith sharing, Bible studies. In our program, we also have a required spiritual formation class for the pastoral ministry students. This class gives students dedicated time within a term to learn more in different ways to experience God. We focus on different traditions and different spiritual disciplines within them. So, for example, we're a Marianist university founded by the Society of Mary. And for one term, we might look at Marianist spirituality within that. And those disciplines within it, like the Marianist silences or the rosary. So some are new to students, like the Marianist silences may be to some of you or to your audience. If they are, I'd note, I encourage you to Google them. Very good. And like the rosary, some of them are well known. So we try to bring a sense of new life or maybe a different experience. And we're lucky to be able to do that here, at UD, in public and private, really nice spaces. We also talk a good bit about how to not have our faith get in the way, some of what I said a little earlier. As ministers, we don't want to block anyone else's faith. And so this means that I have to take care of myself. I have to have an awareness of myself. I have to have a level of maturity from which I can be with people and not get in the way. If I'm struggling with something, it is that much more difficult to be with people and to hear them, to listen, to minister to them. So that really doesn't mean that I don't have struggles. No one's without those, right? But it means having what I need in order to have myself not get in the way of being present to someone else.
Right.
It means that I've attended to any open wounds. And by those that I mean are active. How have I cared for myself within those wounds? I've attended to old wounds. This might mean family issues or from my childhood or having been injured in a relationship with God. And it also means that I have an awareness of my triggers, those things that people that love you can kind of look at sometimes. So that those triggers don't get in the way of my attending to another person, that I'm there for, that I'm ready to hear them, right? With this, I try to be very careful between that difference of hearing and listening. A lot of people can listen and the words just come in and go out. I focus on not just hearing the words, but the meaning, right? Some of us know this is active listening, but I think it goes beyond that. So for example, if one of my students is talking with someone and they say, oh, my roommate got really angry last night, I encourage them to be curious, right? What does angry mean to them? Angry can mean throwing a chair. Angry can mean yelling, but it could also mean hitting walls, hitting people. These are really different meanings. And so it's important to hear people and what they mean. It could be very easy to respond to the student. Oh, wow, it's not fun to have your roommate angry. But it's really different to explore with that student what angry looks like, how it might trigger something in them, and then be attentive to that meaning.
Right.
So I want my students to hear those with whom they are in relationship. And then, and finally, to offer God's hope to them.
Yes, of course, which is the main thing. Thank you, Amy. Talking about self-care and awareness, because as a counselor, you cannot give what you don't have. So, sister, can you share with us what are your thoughts on what has been said so far?
No, what we're hearing is the most important thing is what we're hearing is the ability to listen. And that's the first step in this direction. And I believe what we're hearing is how we are reaching out to one another and that we do have people in pain in so many different areas of their life. And for us to be observant of what's going on in people's lives and to be present to them, that theology of presence, which we talk about so much. Yeah. So I think some of the ideas that are being shared by our panelists here give us a clue of the different types of services that are available to us today. And we should reach out to those people to be there for us, and also how we prepare our people to become ministers, to be caregivers within the church today.
Wonderful. Thank you, sister. So, David, the COVID-19 pandemic has brought many changes to how we live our lives, and with it at times uncertainty, altering daily routines, financial pressures, and as we said before, social isolation. How do you approach people dealing with these stressors?
Good question. Most of my clients come to me and report significant stress. Stress is everywhere. Everyone who comes to my office is in some kind of crisis usually. It can be an acute crisis or it can be a long-term kind of crisis. But most of them report having lost something, either lost a relationship, lost a sense of well-being, of who they are, God. But there's always some kind of loss. One of my heroes in life is Father Richard Rohr, Franciscan priest, and he talks about crisis as a place of what he calls liminality, where the past is no longer working for someone and the future they don't know yet. It's still out there to be revealed. But there's something good about that, in that it's a place where God lives. It's a place of possibility where new life can happen when people recognize that what they've been doing isn't working. So my approach is to acknowledge their stress, as many have said here, to listen carefully, to be present to that. But I often also say to them, stressors are external things that happen to you. What you have a power to do, what you have control over, is how you respond to it. So I try to help clients become curious, as Amy had said, about what's happening to them inside, what it means to them, how it affects how they think, how they feel, how they act with other people. So how they respond to stress, how does it affect their sense of themselves? I try to form a relationship of trust and affirmation. And trust can lead, as many have said, that listening can lead the client to be willing to risk doing something different in their life. I often say, and many have written about this, that client symptoms are their best solution to what their problem is. It's the best effort they can do to solve the problem. But sometimes those efforts don't make sense anymore. They don't work for them. They may have worked at one time or other, but they no longer work. So counseling is a way to provide a non-anxious presence, someone who listens non-judgmentally. It increases a client's belief that they can, in fact, control their life. They do have some power. What we call agency is increased. They believe they can be something different. And people of faith have an enormous resource to draw on, as we all know. Their faith can be a consoling factor in their life, reassure them that they are not alone in their suffering, that God is with them. And pastoral counseling doesn't approach clients using the medical model that we were all trained in, we are counselors, that model of diagnosis and treatment, a kind of pathology approach, but rather the notion of healing and wholeness, the way of bringing Christ's presence to bear on their suffering. It's a little different in the sense of being more of a positive approach toward healing rather than curing a disease or pathology. So those are some things that I thought about with the question.
Thank you, David. Amy, to help us navigate these changes in our lives, we have professional counselors, pastoral counselors, spiritual directors, life coaches, just to name a few. So as coordinator of graduate studies working closely with university students, how do you navigate students towards the type of counseling they may need for mental or spiritual support?
Well, I kind of hate to say it again, but I try to hear them. Right? I'm listening for areas of struggle. With that said, many, by the time they come to me at 22, 23, have established relationships with therapists, psychologists. If they struggle already with mental health issues like anxiety, depression, or even more serious mental health diagnoses.
Yes.
They've been seeing someone regularly for therapy and medication management. So if that's the case, then I'm working with them to find those. If these are new mental health issues, then I'm listening to see what degree of their struggle involves issues of faith. If there's a minimal degree, then I'm comfortable referring them to someone, like David, who's aware of faith issues, but it may not be their specialty, right? I want to look for a good diagnostician. Someone who's going to help them diagnose and get some relief.
Right.
I will also encourage those folks to think about spiritual direction. As people of faith, we cannot think of our spiritual life as separate from our mental health. But it's a continuum. It's, right, we're going from how much mental health crisis are they in and how much faith crisis are they in. And so it's a conversation with the person that I'm referring.
Yes.
I do want to also say that I'm listening for issues of self-harm and suicide. I think those are on the rise. And so it is always important to see how immediate the person who needs help needs that help. Sometimes we need to attend quickly. And for this, I'm trying to offer hope in that time between now and when they are connected with a professional.
Right. Thank you very much.
I'm trying to offer them a different way.
Thank you, Amy.
Mm-hmm.
We're going to wrap up now, but we want to just ask Deacon Mike, from a parish ministry perspective, tell us what are the parish options here for enhancing parishioners' quality of mental and spiritual needs? Just quickly. Deacon Mike?
At one of the parishes, we actually have some spiritual directors available to the staff, to the parishioners. At one of the parishes, we're working to hire a mental health person because it's definitely a need. Oftentimes what happens is people come up to me after Mass and they say, will you keep me in prayer? And I used to say, oh, I will pray for you. But now I stop them and say, what do you want to be prayed for? And then I actually pray for them right in that moment. If it's something like they would need anointing for or further discussion, I might encourage them to seek that spirituality from someone else. And frankly, the last thing I want to say is support your priests. Yeah. Our priests are under a great deal of stress right now.
Yes.
And I have found that they need a lot of our time and care in order to help them manage working with multiple parishes. But again, that comes down to listening and affirming feelings and letting them know that God is with them.
Yes. Thank you very much, Deacon Mike. You know, all our panelists today have contributed so significantly and deeply to our theme of pastoral care. It's all about self-awareness, self-care, listening to self so that you can be present, really, as Sister Angela said, that theology of presence. Present to another as God really wants you to be. So that discernment as well. So thank you to all our panelists and thank you viewers. We have so much more to say. We might have to do a part 2 here because this pastoral care is big. So thank you so very much.
You're welcome.
Welcome.
Thank you.